Alright, welcome to the NinjaGaijin Driving Edition, episode 2. Today's episode is going to be about hospitals and doctor visits in Japan. So just actually recently, yesterday, I visited the hospital. And they might be saying, wow, hospital, what happened? What happened? Well, actually, it's very common in Japan to visit the hospital if you have a cold or something like that. And that's what I had. I got sick over the weekend. And one thing you'll notice about Japan is like the hospitals are just not open on the weekends. It's mind-blowing, but yeah, doctors, hospitals, nothing's really open on the weekends, except some doctor's office, like private offices, they're open on Saturday morning, and that's it. Then they do have like an emergency place that you can go. It's not even in the hospital, actually. It's like in a separate building, and that's open 24/7. But usually the doctor there is like random. What I mean by random is it could be like a pediatrician, it could be, you know, an ENT, you know, ear, nose, and throat doctor. It could be, you know, anything, any type of doctor. So you might, let's say you have like stomach issues and you go and it's like an eye doctor. So he's gonna do his best just to give a basic diagnosis, and then he will just simply give you some medication or a script, take it to the emergency pharmacy, and be like, yeah, go on a weekday to your actual real doctor. But yeah, I'll talk about those in another video. But I want to specifically hone down on hospital visits because that's where I went to yesterday because of my cold. So I went, they open up usually around 8, but they don't actually start seeing patients around 9. I actually went to the Red Cross. There's Red Cross hospitals all across Japan. So I went there and sat down, you know, I gave them my insurance card. Then I gave them my hospital card. One thing you'll notice in Japan that basically every place you go, they have some type of card. So I gave them my, you know, Red Cross card, which of course is free to make. And then I sat there. How long did I sit there? 30 minutes initially. Initially sat there about 30 minutes. Doctor saw me really quick and basically said that, you know, and my complaints were basically runny nose, stuffy nose, sore throat, some chest pain, etc. So he thought maybe I had some congestion, so we had an x-ray done. X-rays are really quick, really easy. If you have had them done before, they're the same here, but if not, I'll just go over it briefly. They basically tell you to take off any metal jewelry, etc. And if you happen to be wearing like 2 clothes, or 2 layers of clothes, they take off the top layer. They tell you to stand, you know, inhale, which is ikisutte. So they might say something like that. So you breathe in, you hold it, they take the picture. Obviously, the reason why they want you to hold your breath is they want you to expand your lungs as much as you can, so it's a clearer picture. And then sometimes they might have you take a side picture, which they did in my case. Basically, I did a side profile with my hands up in like a ballerina position, and it was quick, easy, painless. X-rays are super safe. The amount of radiation that you get is like normally we absorb radiation, so one X-ray is probably about 3 days worth of natural background radiation. So it's literally nothing. The only things you really have to be careful with is a lot of getting like CTs of your abdominal, which could be years worth of radiation. But I mean, if you got to get it done, you got to get it done. Well, anyways, I had the X-ray done, And they also wanted to get a blood test from me. Blood test, once again, super easy. I just went to the literally next door and sat down. They always ask you, standard procedure, you know, are you okay with alcohol wipes, right? So, you know, do you feel like wheezy or easy or uneasy about it? So anyways, usually most people say no, I'm fine. They swipe down your, you know, vein right there. Of course, you can tell them whichever arm that you prefer, but generally they'll choose your left arm because most people are right-handed, right? But I'm left-handed, so for me, I actually usually tell them to choose my right hand. But, you know, whichever one's easier. Sometimes we'll look at both hands or both arms and go with the one that has like the easier to stick vein. Yeah. So they do that, runs it really, it finishes really quick, take 1 or 2 tubes, patch you up, tell you to hold it for a few minutes, just like, you know, normal blood test you've had anywhere else in the world. And they send you on your way. They give you this, they give you back your form, which you go and you take it back with you. You put it behind the door of your said doctor and you wait. Usually the blood test, the results takes about 45 minutes to an hour, so you will be waiting there for a while. In my case, so I got in there at 8:30. I didn't actually get my results for like 9, 10, maybe like 2.5 hours because it was actually pretty crowded. Monday morning, right after the weekend. You can imagine that a lot of people will be going to the hospital, so they had it. But it was okay. You know, my blood results were normal. Of course, the sheet they gave you, everything is in Japanese. But if you ever happen to have any problems, take a picture of it and, you know, send it to me and I'll help you out. But usually they'll point out if anything's abnormal, and they have the normal range written there anyway. So even if you can't necessarily read what each blood test item is, you can at least see if it's in the normal range or not. So everything for me was basically normal. Some things were elevated, like inflammation, but that's normal with common colds, etc. But and the X-ray was turned out pretty normal. He said I might have like a small upper respiratory infection, so he gave me 5 days worth of antibiotics with a separate medication for basically to loose the phlegm in your throat. You know, take that 3 times a day for 5 days, and take the antibiotic. I want to apologize. A car in front of me immediately stopped, and it was a little faster than I thought. But anyways, yeah, safe driving. So went there, finally got out after about 2.5 hours. They give you the script. One thing you'll notice here in Japan is that it's really, really cheap to go to the hospital. Like for example, I got a blood test done, doctor saw me, I got x-ray, I got a script for medication. Everything all inclusive was about 35 bucks, which is phenomenal. Basically the healthcare they have here in Japan is 70-30. So the healthcare, they pay 70 and you pay 30. Which isn't bad at all, and the prices are very reasonable. So I got out a little before 12 noon, and I went to the pharmacy. One thing you'll notice in Japan is that if there's a doctor's office very, very close by, sometimes even next door or across the street, there's a pharmacy. Usually, from what I hear, is they go in sets. Like if there's a doctor's office about to be made, usually a pharmacy will approach them and be like, hey, let's work something out, and they'll be like the pharmacy. Now technically, once you get your script, you can go anywhere you want. You're not like bound to go to a set pharmacy, because I'm pretty sure that'd be illegal. But I mean, it's extremely convenient to walk out and see that there's a pharmacy literally right there. So that's what I did, of course. So I walk out. There's actually 2 pharmacies. I take one, I go in one, and one really cool thing about the pharmacists here is they give you this book, and it doesn't matter which pharmacy you go to, they give you this book, which then you can put in all your future scripts. Like basically, so I went in and I got medication, right? I got the antibiotic medication as well as the throat medication. So I show them my book. I don't actually have it with me, but it's like a small book. And they paste my current medication that I'm taking in it, like the new scripts in the actual book. So in case in the future doctor visits you go, as long as you have the book, and they're like, oh, well, what medication are you taking? And you're like, well, I don't know. So you just hand them the book, and everything's super easy. They'll run the scripts to see if there's any medical or like complications between interactions between current and new medications, etc. And of course, the book is free, which is great. So I give them my book, give them the scripts, I sit down, and I probably wait about a good 10 minutes, 15 minutes or so, and they come back. Usually they tell you, well, do you want generic for a little bit cheaper? And you know, I usually take it because it's the same thing and it'll shave a few bucks off, so why not? And my total bill for that was something like 10 bucks for the medication, and the service is just phenomenal. Like I'm sitting down and they come to you with the bag of medication. They show you what it is. They tell you how to take it. Then they say how much it is, and you pay them without even having to go to the counter. You literally just pay for sitting down in their lounge chairs, and they come back and give you your change, and you're on your way. So that was basically my doctor's visit. If there's something I didn't cover or something specifically that you want to ask about going to the doctors in Japan, hospital visits, certain examinations, chances are I've done them, or I know someone who has done them. So just comment below and let me know, and I'll get back to you as soon as I can. Alright guys, thanks for watching.